Hello and welcome. Our team today will be presenting some of the work that was done by an interdisciplinary work group to break down silos and strengthen the delivery of care for at-risk populations, in particular, our Afghan families who've most recently been resettled in Oklahoma. The objective of the work group we've created was to establish processes that would ensure that continuity of care for Afghan refugees is effective and efficient on the OU-HSC campus. Communication, roles and responsibilities, values and ethics, and teams and teamwork are core IPE competencies. We're excited to share the IPE work we've done that has used these competencies as guiding principles. Oklahoma City was slated to invite approximately 1,000 new neighbors into the community in a 6-month period, spanning from October 2021 to March 2022. Leaders across all disciplines of the OU Health and University of Oklahoma Health Sciences Center, including faculty, staff, administration, and students, set up to create a work group that would identify problems and implement solutions by working across health professions to increase healthcare access for our new neighbors. Interestingly, as the average age of this population was quite low, the healthcare needs are not as chronic or diverse as the work group has initially expected.
Some of the immediate healthcare needs that this population has faced includes the screening, immunizations, and any prophylaxis that the CDC and WHO provide as guidelines for anyone entering a new country. There's also been really important obstetric care that's had to be done. We know that a lot of our new neighbors have been pregnant and have given birth here in the United States since arriving. There's been a lot of dental needs as well. With the shifting landscape of what is covered and not covered with sooner care and other resources for uninsured or underinsured, it's difficult to understand which patients are actually going to be able to receive necessary root canals to save teeth versus having to face extractions. In general, all patients are looking to get some kind of establishment of a primary medical care home. That's been difficult simply because there's been a big influx of patients. Some of the barriers to access to care include the under-resourced and unavailable clinic spots in clinics that accept underinsured and sooner care. It's also difficult to ensure that these clinics have access to the language translation services necessary to carry out a proper health visit. We've had to deploy extra language line and MARDI tools that we can use in our clinics to ensure that our providers are well equipped. Additionally, there's cultural differences. Different perspectives on healthcare exist, as well as transportation challenges, as many of our new neighbors don't have the ability to drive just yet. In order to break down the silos that we see at our campus between our 7 colleges and the other healthcare delivery system organizations, we built a continuity of care work group. And so as soon as our new neighbors began arriving in October, we hosted our first meeting, and we ensured to invite faculty, staff, and leaders from all over campus that could make decisions and could bring information to the table. This included, for example, faculty from the College of Nursing, College of Medicine, College of Pharmacy, as well as representatives from OU Health. We also created a volunteer subcommittee. This was made up of student members that also represented interprofessional activities. These students would lead the implementation of whatever recommendations came from the continuity care work group. We're hoping to get other faculty, staff, and students involved in these volunteer efforts very soon. The ultimate goal of this continuity care work group and volunteer subcommittee was to be sure that we could share the information effectively and efficiently. And we wanted to be sure that any of our community partners that were also sponsoring these refugees or new neighbors would have an easy way to communicate with the health system and ensure that there was no communication lost along the way. Right now, a lot of our new neighbors are using the community health clinic through OU Health, the College of Dentistry, as well as other clinics that you can see on the slide. An important partnership that we've developed is with the Oklahoma Caring Foundation. These folks operate a vaccination van that we've been able to leverage and make sure that a lot of our pediatric patients are getting the vaccinations that they need, as they are currently being threatened by the public school system to not be able to attend school because they haven't had access to the vaccinations that we require here in the States. And so in order to vaccinate those kids and give them the access that they need, we've been able to go to them, directly to them, and eliminate that transportation barrier.
The serial case managers have been critical in building a trusting relationship with the patients. Case managers provide translation during clinic visits and advocate for cultural sensitivity. As an interdisciplinary team, we wanted to extend these efforts by also creating a document that can be provided to health professionals to help optimize the patient experience and communication. Connecting with patients is integral to an effective and sustainable provider-patient relationship. Patients deserve to feel welcome and accepted in all areas of their care. Volunteers and healthcare professionals will be encouraged to use common and relevant phrases in Dari in order to build trust with patients, show respect, and reduce some communication barriers. In order to alleviate the workload of some of the care providers and still maintain a consistent continuum of care for patients, a workflow process map was created with which OU HSC student volunteers will follow and possibly refer to while completing appointments. Engaging volunteers creates a learning opportunity and relevant experience in healthcare administration and logistics, while also delegating tasks to support current providers in offering high-quality care. The map is designed to streamline a system of making referral appointments for patients after they have established care with a primary health provider. Volunteers will be able to receive referrals, find local providers, make and document appointments, and communicate the necessary information to the patient's case manager. This map in the system is still a work in progress.
Students, in collaboration with the Muslim Health Professional Student Association, have worked to develop a cultural workshop to educate students, volunteers on how they can demonstrate cultural humility when interacting with our new neighbors. During orientation, students will receive guidelines on some of the major points of cultural humility. This includes a handout that the subcommittee developed containing brief points on relevant history, religious norms, gender relations, and how those points can impact our new neighbors' healthcare experience. We are actively incorporating new information from our neighbors as they navigate OU Health. Another resource we have utilized is a video and presentation sponsored by the MHPSA in collaboration with the Council on American Islamic Relations that educates healthcare workers on how to approach the Muslim patient. In addition to these resources, the handout includes links to others that volunteers can use to further their understanding and ensure our new neighbors feel welcome and respected. The next steps for this project will be to continue implementing the systems we have developed and continuously reassessing and improving them to provide the best healthcare experience for our new neighbors. Our greatest hope is to transform and expand this project into a long-term feature of OU Health's method of delivering care to the underserved populations of our state.